Oh, somebody already did that. Good morning. Thank you everyone for being here. We will get started in just a few seconds while we allow some folks to join us via Facebook Live. And we see some people trickling in. Good morning, everyone. Thank you for being here. Thank you for joining our community conversation on Central Health 2022 priorities. This community conversation will take place in Spanish at 1 o'clock this afternoon. Esta plática comunitaria se llevará a cabo a la 1 de la tarde el día de hoy. My name is Iván Dávila, and I'm the Director of Communications and Community Engagement at Central Health. Before we look at fiscal year 2022, let's look at our progress during fiscal year 2021.
So in FY21, we really rolled up our sleeves to bring new healthcare clinic locations to the Del Valley and Hornsby Bend communities. We did a lot of review of our data. We looked at the patients, we looked at the population of those communities and where they're headed. And we know that there's tremendous growth in those areas. We talked to the community, we had lots of community engagement, and we engaged a design team. And we are now concluding our design development for both new clinical sites. We're really excited about the opportunities that we're going to have to bring those sites to life in FY22. We want to make sure that these health and wellness sites include these services and programs that really look at the social determinants of health, that really improve and connect to health outcomes, and quite frankly, improve the quality of life for the residents of Del Valley and Hornsby Bend.
I don't think that anybody anticipated the breadth and depth of how COVID was going to affect our community. But Central Health quickly found its footing and its role in the disaster response in a couple of ways. Number one, and most critically, is as a funder of healthcare services. Second, our strong communications, engagement, and outreach efforts. And third, providing programmatic support to community care.
We are so excited to announce that our Customer Service Center launched in October of 2020. Our staff are now handling on average about 8,000 calls a month. Something that we're really proud of is that we have employed eligibility and enrollment specialists to answer our phones. And so when somebody calls, that eligibility and enrollment specialist can help them with whether it be initiating an application from start to finish, and or if they were just missing some information, completing the enrollment for them and mailing them a card that day. So when the pandemic hit, we really had to shift our services, and we quickly created an online application. So individuals now can apply online either at applyformap.net, or our Spanish version can be found at inscribaseamap.net. We currently are receiving on average about 2,000 applications that are submitted online to be enrolled in MAP and MAP Basic.
So for fiscal year 21, one of the strategic priorities around specialty care was really to focus on high need areas for our patients, with one of those being dialysis. Currently, our patients utilize dialysis through the ER, a term in which we call compassionate dialysis. So the new process that we're working to develop would consist of several components. It first would consist of access to consistent standard dialysis, usually 3 times a week for most patients. Also consists of vascular or catheter access, as well as case management and transportation services. As we know, going to dialysis 3 or more times a week can be a burden for some, so having that transportation access is key. The goal of the program is really to provide standard, consistent dialysis in conjunction with wraparound care.
So our medical management expansion really entailed expanding our teams to be able to reach out to more patients. We didn't have the capacity or the bandwidth to reach out to as many patients as we possibly could. And that also included reaching out to patients in local hospitals, patients within the community that needed our help. So what we did is we looked at some data and looked at how many patients we were able to case manage at one time, and then we determined the need for where we wanted our teams, along with how many teams we needed to expand. We also got really creative in developing the infrastructure to really meet the needs of our population. I think that was really a big piece of the medical management expansion this fiscal year, was really being able to target where our patients are, go to our patients, and be able to case manage them through the care continuum.
All right. So with us today, we have Mr. Mike Gislin, Central Health President and CEO. We also have Monica Crowley, who's our Chief Strategy and Planning Officer and Senior Counsel. Stephanie McDonald, our Vice President of Enterprise Coordination and Alignment. Cynthia Gallegos, Service Delivery Operations Director. Lisa Owens, Deputy Chief Financial Officer. Jana Allen, Diversity and Inclusion Manager. And Ted Burton, Vice President of Communications. We also have wonderful members of our production team with us, Yesenia Ramos and Anastasia Sims. Thanks for being here today. Before we get started, we'd like to go over some virtual house rules. We recognize the collective trauma endured by communities who've repeatedly been impacted by health inequities. We recognize that this trauma can be manifested by expressions of anger and frustration. Having said that, we are committed to creating an atmosphere of mutually respectful and beneficial dialogue. And we ask our public meeting attendees to join us in this commitment. To maintain a cohesive and productive working environment, we commit to staying aligned with our mission, offering alternative solutions when addressing a problem or issue, showing respect to each other, promoting productive discourse during our meetings. When the discourse has become disrespectful and unproductive, the moderators commit to intervening to preserve a constructive environment for all participants. Having said that, if a question comes up during our presentation, please drop it in the Facebook comments and we'll address it during the Q&A portion of this meeting. If we don't get to your question, we will have our experts address them and we will send them to all the participants who RSVP'd in a follow-up email and answer them in the comment section of the Facebook Live. Thanks again, everyone, for being here today. Let me share another screen. Okay, today we will share with you Central Health's fiscal year 2021 accomplishments, Central Health's proposed fiscal year 2022 priorities, the fiscal year 2022 budget development timeline, and also ways to get involved. I'll now hand it over to Mr. Mike Gislin, who will kick us off this morning.
Yes, thank you. And good morning, everyone. And thank you for joining us on Facebook Live. If you'll go to the next slide, please. So first, a little bit about Central Health. Central Health is the healthcare district for Travis County. We're statutorily created, and we are funded by property tax dollars as well as other sources of revenue. And we provide healthcare. We provide access to healthcare. Currently in Travis County, that equates to about 1 in every 9 people that live in Travis County. We're governed by a 9-member board of managers that sets the strategic objectives and direction for the organization, as well as the ultimate decision-making authority for the district. And then once those directions are set, we set about recommending a budget to be able to achieve those objectives that are established by the board. Now, how do we go about providing access to healthcare? At Central Health, we have many partnerships across the enterprise, but principally community care and Sendero healthcare plans, community care being a federally qualified health center, Sendero being a community-based not-for-profit HMO. And those are our enterprise partners. But we also have other partnerships within the community with hospitals, other clinical providers, transitions of care service providers. to make sure that we're putting together as robust and complete a network and a set of programs to make sure that we're providing robust access to healthcare. So one of the important pieces to remember as we're walking through the presentation today is the medical access program. You saw that on the video about some of the work that we've done to improve upon enrollment eligibility. The medical access program over the course of the year is going to enroll over 100,000 people. On any given month. On average, it serves well over 58, upwards of 59,000 people, and those numbers are more recent. But what's important about the medical access program is that by reimbursing for care and providing a strong healthcare network as we can, for those that are living below 200% of the federal poverty level, we are able to make a difference in their lives and help them achieve health equity in living the healthiest life possible. Next slide, please. So right here, you see 2020 by the numbers, and this is the cover page to our annual report. And I'll draw your attention to the upper left-hand corner here, 138,448 in fiscal year 2020. That represents the number of individuals that either directly or indirectly we were able to provide access to care for, not only through the medical access program, but through across all of our clinical partners here in Travis County. And this, you'll hear more about this as we get into the budget process throughout this summer, but making certain that we are not only expanding service opportunities like what we're doing, or excuse me, site expansions like what we're doing in Eastern Travis County that Stephanie McDonald spoke to in the video, but also what we're doing in certain lines of service, whether that's healthcare to address hypertension, diabetes, and any number of conditions that affect the folks that we're privileged to serve, making sure again that we're building out that network so that we can continue to do more and serve more here in Travis County. At this point, I will hand it over to Monica Crowley.
Thank you, Mike. And next slide, please. So we presented our fiscal year 2022 strategic priorities to the Central Health Board last month. And we're grateful today that we're able to bring them to you in order to seek your feedback. Today starts this process. And later on during the presentations, Yvonne is going to describe other ways that you're going to be able to participate in this process in addition to this community conversation today. As you will notice, as we go through the proposed fiscal year 2022 priorities, many of them build off the great work that was described in the fiscal year 2021 video that kicked off this meeting today. Related to expanding services in Eastern Travis County. Stephanie McDonald is available to answer any questions that you guys might have later in the presentation, but you saw a lot of information about the progress that was made in fiscal year 2021 in the video. And as you can see from this slide, we will be continuing to build these clinics in Hornsby Bend, our health and wellness centers in Hornsby Bend and Del Valley in fiscal year 2022. And the planning around the Colony Park Health and Wellness Center will continue and ramp up in fiscal year 2022 as well. Next slide, please. I'm also really excited to get to discuss another multi-year priority around equity-based systems planning to improve access to care by building a comprehensive, high-functioning healthcare system that is focused on health equity. This slide depicts a graphic image of the components of a high-functioning healthcare system. And if you look, there are different key components, there are subcomponents in each of those components, and then there are integrating components that you can see in the middle that provide, that help all of the other cogs work together. The goal of this work for Central Health is to identify the gaps that we have in our current system today in Travis County, and for Central Health to lead a strategic, system-wide approach to addressing these gaps in the short term and the long term to ensure that there are complete care pathways available to low-income Travis County residents, with the goal being to improve clinical outcomes, reduce mortality, improve health equity, and reduce health disparities, and improve the quality of life of those we serve. This work is larger than just Central Health, and so we are taking a layered approach. In fiscal year 2021, this work began identifying the initial components of the high functioning system, identifying and evaluating gaps, using a number of prioritization factors such as patient surveys, clinician input, and proposing initial service delivery priorities for the Central Health Board to fund in fiscal year 2022. And during the next slide, Cynthia Gallegos is going to provide more detail on how we prioritize the initiatives and what the areas of the proposed work will cover in fiscal year 2022. The overall larger planning work is going to expand in fiscal year 2022. And we are going to be working with the patients and communities we serve and could be serving, partners and other stakeholders to develop a comprehensive, equity-focused strategic healthcare services plan that reflects Central Health's role in shaping the system of care and Central Health's commitment to work with our communities to build this high-functioning system of care. Thank you. Now I'm going to hand it off to Cynthia Gallegos.
All right, next slide. All right, so hi, my name is Cynthia Gallegos. I am the Director of Service Delivery Operations here with Central Health. As Monica mentioned, I'll go ahead and speak to a couple of the prioritization factors that have been considered as part of the larger systems planning work that she was just speaking to. These items have really helped surface the more immediate focus priority areas that I'll be speaking to shortly. So I'll just touch on a couple of these, piggybacking off of what Monica was just sharing. We really wanted to make sure that we helped identify more immediate initiatives that were going to help reduce disparities as well as promote health equity. A couple of the items that we ended up focusing in on for FY22 were also really closely related to initiatives and service areas that had been previously identified by clinical subject matter experts to better help us get to a place where we could close service gaps. We also wanted to make sure that just looking internally to resources that were available for us, as well as looking externally to partners that we'd be working with these next coming years, that we looked at the bandwidth of resources that we had available. So those were some of the key contributing factors to some of the work that you'll be looking at. Lastly, and probably one of the more important items, we really wanted to make sure that we looked at patient surveys as well as care team feedback. So a lot of the initiatives that surfaced to the top were really building upon some of these contributing factors that I'll be jumping into. Next slide. All right, so here we have the 6 service delivery priority areas that we'll be focusing on for FY22. We have some really exciting work ahead for us. I'll go ahead and launch us in through specialty care access. Just to give you an idea, every year Central Health tries to work to build on existing services, kind of like what Monica was just mentioning. We really try and identify areas that we can build off of, as well as new areas of service that we can make available to our members that we serve. This year, we'll be prioritizing the continued expansion for a couple of service areas, which include endocrinology, cardiology, nephrology, and podiatry, just to name a couple. We'll also be expanding into new service areas. This year, that includes medical weight loss. Dialysis will continue building off of some of the foundational work that we're getting off the ground this year and really moving that work forward. We're also really excited to move into a more enhanced cardiology diagnostic and transition space in the medical home, as well as really starting to drive forward our surgical podiatry work that we have set to launch at the end of this fiscal year. Moving into healthcare for the homeless, This is an area that we know from looking at the data that our MAP members who are experiencing homelessness have poorer health outcomes. Not only are they less likely to seek out behavioral health services, but they're a lot more likely to use emergency services compared to members that have access to safe and adequate housing. So improving the health of this population, it's a major focus for our service delivery. And we have plans to do this by working with our community partners to expand existing services, such as our street medicine teams. We also have plans to launch a really exciting one, medical respite services for the MAP members experiencing homelessness. And this is really so that they have a safe place to stay while recovering from an illness or treatment under the care of medical staff. Lastly, in this space, I did want to make sure I mentioned that we'd be introducing behavioral health into street medicine teams, as well as homeless service sites in order to help patients in acute medical distress. So I'll go ahead and speak to a little bit about behavioral health, along with the work that I just mentioned for healthcare for the homeless. We really want to make sure that our priorities for next year in the behavioral health space include expanding psychiatry access as well as therapy in the primary care setting. We're also really focusing on providing more behavioral health services via telemedicine, just so that we can try and reach additional individuals in that modality. Moving on to substance use disorder treatment, this is an area that we need to address around substance use disorder treatment. Central Health has plans to introduce access to peer support specialists. These are people who have been there, kind of done that, and have recovered. This is really to help engage with empathy, as well engage with our patients in the hospital for alcohol use related conditions. We'll also be launching a program with the Sobering Center to offer safe place for Sobering Center MAP patients to stay while their treatment bed is located. So that's another really exciting piece of work this coming fiscal year. And then lastly, in this space, we'll be expanding the use of our medication assistant therapy program. This is a combination of counseling, therapy, and medicine that's been shown to help prevent relapses. Transitions of care, currently fewer than half of Central Health's members have a follow-up visit with a primary care provider within a week of leaving the hospital. These transitions of care, like leaving the hospital, are where patients sometimes fall through the cracks, leading to worse health outcomes, as you can imagine. We are dedicated to providing members seamless transfers between providers, services, as well as settings, because we know that effective transitions lead to reduced readmissions to the hospital, as well as shorter inpatient stays, higher patient satisfaction, and of course, better outcomes. So with this, for FY22, we have plans to expand our medical management team. And I know you saw a little bit about that in our recap video, which is really exciting. We really want to reach a larger group of MAP Basic members, including those with complex medical problems, such as congestive heart failure. We'll also be providing services to help patients after a hospitalization. This includes transitions to a skilled nursing facility, home health visits, palliative care, as well as hospice care. And I'll go ahead and jump into this last one. So clinical and patient education, this is a really new, exciting space that Central Health will be getting into. We recognize here at Central Health that while patient education is important, provider education is equally important, as it relates to how to talk effectively to patients, as well as how it will improve communications during a medical visit. So, this next fiscal year, we believe that as communication between patients and providers can improve, we can help improve the trust that patients have, as well as the adherence to their care plans. This, of course, can help lead to better health outcomes. In FY22, we're planning to develop a clinical education program to hopefully address culturally appropriate communications centered on the patient's goals and health. So I'll stop there, and I believe I'll go ahead and turn it over to Jana.
Thank you, Cynthia. Next slide. Thank you. So my name is Jana Allen, and I am our Diversity and Inclusion Manager at Central Health. And this slide, we're talking about building a culture of health equity. And you've heard about a lot of the ways that this manifests externally. And now we're going to talk about what that looks like within Central Health as an organization. You know, we often hear that about 80% of an individual's health is determined by social factors outside of the clinic. Lack of access to healthy food, safe housing, quality education, jobs paying living wages, and so much more. And we also know that these aren't only social factors, but justice issues. At Central Health, we understand that by the time people come to us seeking coverage or care, they've endured a plethora of systemic injustices. So in order to effectively address the health inequities that our members experience, we must intentionally create a culture of equity across the enterprise. Some of the ways that we do that and we keep our collective purpose in mind to improve health outcomes for those who are most impacted by health disparities is through the work of our Equity and Inclusion Task Force. So in 2019, Central Health created an employee equity and inclusion task force. And this group of dedicated and creative staff members came together and created equity and inclusion goals, objectives, standards, and values for Central Health. And so some of the ways that that work has manifested and some of the recommendations out of that group have come through also having health equity training for employees. At Central Health, we just completed our first ever diversity and inclusion awareness training last month, and that was phase 1 during this fiscal year. In our next fiscal year, we're currently in the process of selecting a vendor for a larger enterprise-wide health equity training, where we're looking at the intersections of how people's experiences and history impact the health outcomes that we see. And with the picture you see on the slide of equality, equity, justice, this health equity training also gets to the root of how have some of the issues of justice impacted the way people access care, the way they experience our healthcare system, and what can we do to eliminate those systemic barriers, and how do we promote everyone having the resources that they need. And so the task force is now working on employee resource groups and developing some of the guidelines around that, opportunities for mentoring and career development, and also continuing to work on retaining a more diverse workforce. With that, we've also been working with the finance department. I know that Lisa Owens is up next, but we've been working on our historically underutilized business disparity study. And so looking at the vendors that have been working with Central Health, the results of that will be coming out soon. But just to say that we know that in order to promote health equity, a lot of work has to happen internally and externally, and that work is going on at the same time. And so with that, I will turn it over to Lisa Owens.
Thank you, Jana. Hi, everyone. I'm Lisa Owens, the Deputy CFO. It's great to be here today. So as my colleagues just explained, there's a lot of great work that's going to be happening in fiscal year 2020 for us, which starts October 1st. And what you're going to see in our budget documents is that work in our healthcare services budget, in our healthcare operations budget, and other active projects in the FY22 budget to fund those great expansions of services and initiatives. But another major component of our budgeting process is the long-term sustainability and the longer-term look at the organization. So I just want to highlight a few of the longer-term areas that you're also going to see in our budget. Maintaining sufficient reserves so that we can continue to increase access to care. We do maintain healthcare reserves, and those are available for future healthcare projects, initiatives, and expanding services to MAP and MAP Basic. And that those reserves are available for planned or one-time expenditures that we may know are coming. We also have a major investment. I think Monica started, and we saw some great pictures of the new 2 new clinics just to start in Hornsby Bend and Dow Valley. But our clinical facilities investments and headquarters consolidation, which was recently approved by the board, will be showing in our capital budget and planning. And we presented a preview of that in our earlier this year in May. but you will want to continue to watch those updates as we show that those project budgets are underway. They're approved by the board, and we'll be reporting out through the capital budget process on significant investments for 3 new clinics in Eastern Travis County and clinical services and a headquarters consolidation in the central corridor of the county. And lastly, another long-term area where there are investments, and you'll see lease revenue in our annual budget, is the demolition and redevelopment of the downtown campus where the former UMCB hospital was. The demolition is anticipated to be completed this summer. And then we have blocks that are currently under long-term ground leases, and that generates about $13 million in our preliminary budget annually to Central Health through long-term ground leases and facility leases. And then those future blocks are available, and they can be used to develop new projects, generate revenue, and that revenue will be used to invest in healthcare throughout the entire county to serve our patients and their families. And go to the next slide and talk about the timeline. So I think everyone stressed this is the beginning. We actually started a lot of the internal work on this right after the first of the year with department budgets and planning. But this is the beginning of pulling together a preliminary budget. It was presented to our board the other night, June 14th on Monday. And so we hope that you'll take a look at that. There's a lot more coming though. And so I want to really focus on what's coming and what's available to the public. We're going to have public involvement. Yvonne's going to go through a lot of that detail next, so I won't get into too much there, but lots of opportunity for community engagement. Our website has a dedicated page to the development of the FY22 budget. We post all of the presentations there, additional information, and is available. There also will be a preliminary budget booklet that has been available in the past, and that will also be released on our website later this month. That has information not only about how we operate, but the details of what's in primary care, what's in specialty care. And it's a very useful tool for you to learn more about who we are and how we operate. In July and August, we will be aligning the strategies that you've heard about into that draft budget. That final draft budget will go to the board in August when we start our tax rate process and final approval of the budget in September. We do anticipate bringing a final budget and a proposed tax rate to our board in September, and ultimately the Commissioner's Court, Travis County Commissioner's Court, towards the end of September. So there's a lot of opportunities to get involved. We have a lot of meetings that all have citizens communication available, as well as very important public hearings and public meetings towards the end of the process. We look forward to hearing from you. With that, I'm going to turn it over to Yvonne, who's going to talk through all the ways to get involved and share your feedback.
Thank you, Lisa. Yes, so on the screen, you'll see the different ways to get involved. And so starting with the online survey and telephone interviews, we want to make sure that we hear from anyone who has the ability to give us feedback, anyone who would like to give us feedback on our proposed strategic priorities for fiscal year 2022. We are launching an online participation platform that integrates with texting as well, but the web address is at the bottom of the screen. We're launching this next week. So anyone who RSVP to this community conversation will receive an email letting them know to visit us on this website, and we'll be posting it on Facebook and all over social media as well. But the website address is at the bottom of the screen: participate.centralhealth.net. You will be able to get all of the information around the 2022 budget and all the documents that Lisa mentioned at this location as well. The online survey will be available and open to the public when we launch this website all the way through July 18th. And we also highly value feedback from our members, MAP and MAP Basic members. So we're going to be actually picking up the phone and calling members, MAP members, and asking them questions related to the survey, related to the strategic priorities, to make sure that we're also hearing directly from MAP members as it relates to the strategic priorities and as it relates to the way that they impact them. And then August 4th, we're going to be posting the engagement report, and that will include top level trends analysis on the survey results and the telephone interviews results. And this will be posted again at this same website that's at the bottom of the screen. On August 26th, we will have a community conversation similar to the one we're having now, and this one will be on the 2022 proposed budget, and we'll be discussing the budget at great length. Lisa Owens, who just spoke to us a little bit ago, will be talking to us through the budget with us, and what's all included based on public feedback. Then September 2nd is the budget public hearing, and so all of this information will be found at this link that's posted at the bottom, and much more. Lisa mentioned the budget booklet and all the different financial documents, all of that. There will be links that will take you to all of these different documents on this platform, participate.centralhealth.net/2022 budget. And with that, I'm going to turn it over to Ted Burton, who will facilitate the Q&A portion of this meeting. Ted, there is a question on Facebook that's come up, and I'll let you take it over. I'm going to go ahead and stop the sharing of the screen.
Thank you, Yvonne. As Yvonne mentioned, if you do have questions or comments, we encourage you to please post them in the Facebook Live chat, and we will either answer them now, or if you have questions that come up, perhaps you watch this community conversation at a later time, we will answer those questions and share them via our Facebook and on the Central Health website. As we dive into some questions, I did want to follow up with Lisa. Lisa, we had a couple of big milestones occur in the last couple of weeks regarding the budget. I wonder if you would share a little bit more about the board action from Monday night, which increased exemptions, homestead exemptions for seniors and veterans.
Sure. As you know, Ted, and as I'll explain, we do offer exemptions to property tax owners who have a homestead exemption. We offer the maximum amount by law, 20% for a homestead exemption. And then we also have two local homestead exemptions for persons who are over 65 or disabled. Currently, those are at $85,500. And our board took action to recommend that the Commissioner's Court, who has ultimate tax rate setting for Central Health, increase those both to $100,000 for this upcoming year. So we anticipate that going to the Commissioner's Court later this month.
Thank you, Lisa, for that update. And also in the last couple of weeks, I believe it was last week, the City Council approved our zoning requests for the downtown campus or downtown property, former home of University Medical Center Brackenridge. And that literally clears the way for the redevelopment of that, or the continued redevelopment of that property. So that was a large milestone that Central Health had been working on for a couple of years now. So with that, we'll be able to continue looking for opportunities to redevelop that property. And of course, Lisa, as you mentioned, the point of that redevelopment is to generate funds now and in the future to pay for healthcare here in Travis County. We do have one comment on Facebook. It's really not a question, but it's a comment, and perhaps somebody could address just a concern that the phone hold times on the phone with our phone system are too long. And I know in the video that we saw earlier, Kit Abney-Spels talked about enhancements and improvements to our eligibility department and our new customer service department. But is there something in the budget, Lisa, I don't want to put you on the spot, regarding technology or IT relating to the phone system? And yes, we acknowledge that sometimes during peak periods, especially, calls to our eligibility office can be longer than we desire.
Hey, Ted, before Lisa discusses the specifics on the budget relative to the phone system, let me just say, first of all, we really appreciate the comment and the feedback on that. I know that whenever the team launched the call center for the medical access program eligibility and enrollment in October, there was a significant hiring effort underway, as well as putting in new processes and procedures. And the capture rate of the calls, meaning the number of calls that we're able to answer, but also the time it takes to get to those calls, has improved greatly since the call center started, and will continue to improve. And that's a commitment from us to the folks that we're privileged to serve, to make that enrollment experience better. And enrolling in the medical access program is very much a part of the larger healthcare experience. And so that's an important part to us. Now, if what the question is referring to, and I'm going to go out on a limb here and suggest that maybe it's there's a couple of different call centers. So for example, some of our clinical partners have call centers to be able to make appointments, maybe even to help triage certain situations. Those comments, we take those seriously. And so if it's not the medical access program enrollment eligibility call center, but yet maybe another clinical partner, that's something that we would like to go back and look into and bring back and have some conversations around as part of this larger budget process. Thank you.
Mike, there was a higher call volume during COVID as everything did transition to literally to telemedicine and telehealth, both for appointments and people who were seeking information about COVID testing, and now vaccines. So there was definitely a higher demand. But also worth noting, during the pandemic, MAP eligibility went online, so people could enroll and re-enroll in MAP via the website versus having to call in or come to an office. We don't have a lot of other questions from people who are watching this conversation, so I thought it might be helpful if we could just do around the table, so to speak, and perhaps people could just share the one big takeaway that they would like viewers to remember as we move into budget season and then into fiscal year 2022. And Monica, you talked about service expansion, and perhaps you or Stephanie could just, as a reminder, talk about the timelines surrounding the health and wellness centers in Colony Park, well, actually Del Valley and Hornsby Bend, and then the planning process for the Colony Park Health and Wellness Center. And Stephanie, I don't know if you want to take that one. I know it's a question that came up during our community conversations last week.
I'm happy to take this question. Thank you so much. We're really excited that we are wrapping up the design process for both the Del Valley and Hornsby Bend sites. We've already completed the floor plan for the Hornsby Bend site. We're hoping to get final sign off tomorrow on the Del Valley site. And then as those design documents are developed, they will lead to construction documents. We hope those construction documents will be drawn up and ready to go for our contractors to bid later this summer. So we are projecting right now late July, potentially early August for that. And then once the contractor is on board, there are a series of regulatory events that are happening simultaneously in both sites. This includes site plan permit review. It will include later on building permit applications, as well as some utility applications that are going on specific to our Hornsby Bend site. All of that work, though, will, we hope, lead to construction and active construction, groundbreaking, dirt moving later on in this calendar year, with hopefully a groundbreaking event in the fall. We do know that it's a challenging time in terms of there's a lot of shortfalls, lead times for materials, labor shortages, and we know that it's a very, there's inflation concerns going on, and it's impacting our construction projects the most. So I want to make sure everyone's aware of those conditions. The Colony Park project, we have exciting news that the Austin City Council approved the allocation of some federal dollars to build the infrastructure that would support our project, as well as the Loyola Town Center and the Colony Park Master Plan community plans. And we hope that in August, both the Austin City Council as well as the Central Health Board of Managers will approve interlocal agreements that will allow Central Health to purchase land in the Colony Park Master Plan area from the City of Austin, as well as an agreement that will have shared cooperation for a preliminary design for the new Health and Wellness Center, potentially additional city services on that property in Colony Park. And we will get going on the design process later on in the start of fiscal year 22.
Thank you for that. Monica, I wanted to circle back with you on equity-based systems planning. This will be a transformative initiative for Central Health and our community. And it is already underway, as you mentioned, but perhaps you could just, for our viewers, recap the timeline, where we are now in the process. And this is a multi-year process. It's not going to happen by October 1st. But could you talk about the timeline for this process and the opportunities that the community will have to participate in this planning process?
Absolutely. Thanks so much, Ted. As we're moving forward with this equity-focused system planning effort, where we are in the process, we are completing the current year's work, continuing to polish up the recommendations for the fiscal year 2022 immediate initiatives. And that work is going to continue as this budget timeline that Lisa and Yvonne have talked about. So we're now going through the process of bringing deep dives on the different proposed initiative to the Central Health Board in our strategic planning committee meetings. And then as we move into fiscal year 2022, we're going to continue with a deeper analysis and assessment of gaps, of potential disparities in health outcomes, of network adequacy, and current and future health needs, demographically for both the patients that we're currently serving and populations that we should be serving but that we're not today, geographically and by type of service line. And this next deeper analysis is going to include a community needs assessment that really is focused on the current and future needs of low-income residents in Travis County, and a much deeper engagement and intense engagement with our patients, community members, and partners through work groups, through advisory groups, through surveys, through focus groups, through additional community conversations between now and October, November of this year, leading to the development of this longer term strategic system of care service plan that we will be recommending to the board for consideration in December and January. So we're going to have many other, we're going to be working through the strategic planning committee and also with you and Yvonne and our team to do this much more intense community engagement around this work.
And speaking of community engagement, Lorena Cruz, who's one of our community partners and member of one of our advisory committees, just wanted to say thank you or glad to see that we're addressing inequality. And she's been instrumental in the Kennedy Ridge, Hornsby Bend area, connecting residents to the process of the development of our health and wellness center. So we're glad to see Lorena is on the call. And speaking of inequality, Monica, could you just explain when we say equity-based systems planning, what does that mean?
So what it means is really in Travis County, we don't have one organization that, if you remember the COG slide that we showed during the presentations, there's not one organization or entity that owns all of the pieces of those slides. And so many times when there has been planning around improving different elements of care that people need, the planning has been focused on more individual kind of siloed needs of the different provider organizations. This work that we are doing now is really focused on identifying gaps, identifying disparities across different populations and different geographies in both health outcomes and in accessibility and the availability of the different types of care, and focused on the needs of the communities that we should be serving, and then of the patients that we're currently serving, and then developing proposals and priorities for initiatives to address those gaps. So we're really focused on the people being served in their needs, and not necessarily on the individual components of the system.
Thank you. Cynthia, you talked about a lot of exciting service delivery priorities for next year, and some are new, but others are actually carryover, and the work has already begun. One example would be healthcare for people who are unhoused. But I'm going to put you on the spot. You mentioned six different priority areas, but of all of these, is there one that you're particularly excited about, or and sorry, I know we didn't plan this, but is there one that really stands out? I know healthcare for people who are experiencing homelessness is a really big challenge and topic for our community. And so I think some people may be surprised that there is a lot going on, but that perhaps they don't know about, because the camping ban tends to suck up all the oxygen around this issue. So is there, maybe you want to expand on that, or is there another one that you're really personally excited about for next year?
They all really make me excited. Let me just put that out there, Ted.
I knew that would be your answer.
Lots of work coming. I think the one that really stands out to me, just given kind of the environment and a lot of what Monica was speaking to related to systems planning, is going to be around this transitions of care work. There is going to be a heavy lift there. There is going to be a lot of attention there. There's going to be a lot of really good work amongst several partners, community members in that space. So alongside with healthcare for the homeless, I think that's just going to be another area that really catches a lot of excitement this next fiscal year.
Thank you. As we begin to wrap up, Mike, I'm going to actually turn it over to you and see if you have any closing thoughts. And just remind people, if they are watching now and a question comes to mind later, or if they're watching this recorded and posted later on Facebook, please post comments or questions in the chat, and we will respond to those questions as quickly and efficiently as possible. And then Yvonne can recap all of the community engagement opportunities between now and our budget adoption in September. But Mike, did you have any closing thoughts for this conversation?
Yes, thank you. And again, I want to thank everybody for joining us on Facebook Live, and to all of our colleagues here that have joined us here to present this information. And Lorena, thank you so much for your comments about inequality and thinking that and pulling that into the health equity conversation that we just had. That is so important. And being connected to what we're doing is so important. And Lorena, you're a great example, as Ted pointed out, about helping us connect with communities and people that we are privileged to serve and should serve into the future. So I think that continuing to be engaged in this process is going to be important. But as you can see, there was tremendous strides made in 20 and 21. Even in the face of a pandemic, and we are going to continue to move forward at an increasing faster rate and in a much bigger scope. And taking and looking at forward to the next fiscal year, it's taking it all to the next level and really being deliberate about who we are as an organization culturally, and being inclusive and equitable and diverse, so that externally, when we serve people, that we are doing so in a culturally affirming way, but also, as Monica mentioned and many others, looking through that health equity lens. What gaps are there that we need to address that either for historic or present day reasons, whether it's institutional or systemic racism or lack of proper connections with patients in culturally affirming ways in terms of how we communicate, or maybe it's just a misunderstanding of the data, for whatever the reason is that causes the gap. We want to embrace all of that and work very diligently to address those gaps so that people, not 10 years from now, but today, continue to live the healthiest life possible. So with that, we are very excited about this upcoming budget process. We wanted to put the foundations out there. There's many more opportunities coming to talk about what we're doing strategically in communities and in the various care lines of service that Cynthia covered, but also what we're doing culturally as an organization that Jana talked about as well. So there's everything's on the table for conversation, and we look forward to it. Thank you.
Thank you, Mike. Yvonne, I'm going to turn it back over to you and just remind people we encourage them to continue to be part of this conversation, whether it's at a meeting like this one or online, but you can visit centralhealth.net/2022 budget for the latest information about our budget process and our priorities for next year. And there's a lot more information coming out soon about our equity-based systems planning process. So stay tuned for that as well. Yvonne?
Thank you, Ted. That's right. And we're about to launch a new online engagement platform, and the address is on the bottom of the screen, participate.centralhealth.net. And for to engage in the 2022 budget process, you can go to /2022 budget. And there on the screen, you also see the many different opportunities that the people will have to participate in the budget process. Again, through this online engagement platform, in the next few weeks, there will be a survey that people will be able to take. And then, of course, because we care a lot about what our members have to say about our work, we will actually pick up the phone and conduct phone interviews with our MAP members pertinent to our proposed strategic priorities for fiscal year 2022. The report will be published on this platform on August 4th, and then we will have a community presentation again on August 26th, where we will discuss the 2022 proposed budget based on all the work that's been going in internally, but also externally with the engagement. And then September 2nd will be the budget public hearing. And so those are the opportunities to engage. The online platform will be there during this whole process, even after the survey closes. We will have opportunities for people to weigh in and give us their thoughts. It's got a lot of different tools for people to engage with us in. And so those are the ways people can engage with us, Ted, and I'll turn it back over to you.
Thanks, everybody. Thank you to my colleagues on the panel, and more importantly, and most importantly, thank you to everybody who took time out today to join us. Yvonne will be hosting this community conversation in Spanish in 30 minutes at 1 o'clock. And so we invite you or anyone you know to join us for that. And again, just as one last reminder, if you have more questions, thoughts, or comments, please share them, and we will respond to them as efficiently and quickly as we can. So thank you, everybody. Have a great rest of your day, and we'll see hopefully some of you back at 1 o'clock. Thank you.
Thank you. Thank you.